It's a time of confusion and frustration for many people as COVID-19 cases spike across the tri-state area. We've seen the pictures, people waiting online for hours to get tested. We know now the highly contagious Omicron variant is here, and now some vaccinated and boosted people are experiencing these so-called breakthrough cases. Questions, we all have them, and here to help sort out this uncertainty, Dr. Daniel Varga, the Chief Physician Executive at Hackensack Meridian Health. And we've turned to you before, and we're grateful for that, for some guidance during this. So we welcome you, Dr. Varga. We welcome you back.
Thanks so much for having me.
Oh, very, very nice to have you. So we've seen this major increase across the metro area, and just kind of a basic question, because it was Delta, Delta, Delta. Now we're hearing Omicron. Is there a breakdown? Do we know? Is it all Omicron now?
Yes, so the vast majority, probably 75% or more of the new cases that we're seeing today are the Omicron variant. And the reason is it's just so contagious. It has a very short incubation. It's double, what we call the doubling time is really, really fast. So it spreads like wildfire.
Is it spreading the same way, the droplets? I mean, we know mask up, get your vaccinations, get boosted. Does it spread the same way?
It does. It has the same basic biology as the other COVID viruses have. It just moves quicker.
So we hear about these breakthrough cases as Omicron moves more quickly. How is that happening?
So if you take several categories, so take the completely unvaccinated.
Okay.
I mean, they're highly susceptible, as you might expect. The fully vaccinated, meaning that they've had 2 shots of one of the mRNA vaccines or the J&J, 1 shot of the J&J vaccine, have some protection against it, although not nearly as much as you'd like. It still prevents against severe illness, hospitalization, death, but it's much, much less effective than it was against the original variant. And then you take your boosted individuals. They actually have pretty good protection, but it's not nearly as good as it was against the original variant. Still very, very good. So your best shot is really to be a fully boosted individual. That said, there's still about a 25 to 30% chance of a breakthrough infection.
And is that chance greater with someone who's vulnerable with other health issues?
Of course it is.
And if they've been vaccinated and boosted, I'm saying.
Exactly.
Sure.
I mean, even for the fully vaccinated and boosted individuals, if you were to just look at our hospitals right now, where we have seen a rise in the overall hospitalizations, the folks that are seriously ill are really the elderly, the vulnerable, who are all vaccinated. I mean, when you're looking at the vaccinated crew.
Of course, gotcha. The question has, been this whole year plus, almost 2 years. If you've been exposed to someone who tests positive, just say someone walked in here, I found out that person tested positive. What should I do? When should I get a test?
So, right now we're strongly encouraging folks to test broadly. I mean, the way you get out of a pandemic is with vaccines and lots of testing. And so the value of aggressive early testing, particularly with this variant, which moves so quickly, is really, really critical for us.
These rapid tests, when we know there are those, and then there are the other ones that take a couple of days with the nasal swab. I hate to say this, when I see so many people waiting in line, the rapid tests, what's their efficacy rate? Do we know?
So the rapid test is incredibly effective at ruling out disease. So you do a little antigen test, swab the front of the nose. 15 minutes later, you've got a result. If it's negative, it's a very, very accurate result. If you have a positive test, it still needs confirmation with a PCR test. But where it's really useful, say it's a holiday gathering, if you get 10 people getting together, everybody does an antigen test before they come in, they're all negative. I want to be a part of that party.
Exactly. So you're saying then that that's one of the most important steps. And again, from Dr. Fauci, from everyone, and of course, we're hearing this, and family members and friends need to talk about that too. I've talked to people who say, well, then you're not coming if you don't get a test before coming with the family. That's what you're advising, to make sure you're tested.
To the degree that you can. I mean,
Sure.
we know a lot of folks have been struggling to actually find rapid tests so that they can do them. I mean, it's tough to run them down. But if you have the ability to do a rapid test, say before you go visit your mom and dad who are in their 80s, et cetera, it's a really smart thing to do.
Mm. What's the other side of this, Dr. Varga, about hesitancy, which has been an issue, as we know, for months and months and months? What effect will what's going on now, do you think, have on vaccine hesitancy?
Well, so I mean, to a large extent, the vaccine hesitancy we've seen to date has really created the pool of people in which the variants could develop. So had we gotten, a much more a higher number of people vaccinated early on, there's a likelihood we may not have developed all of these variants. That said, the one thing we worry about right now is it's clear that the standard vaccines that we have right now, the messenger RNA vaccines, are probably not as effective against Omicron as they were against Delta and the earlier variants. And we worry that that creates people, saying, hey, look, it seems like it's not that severe an illness. The vaccines aren't perfect. Why don't I just get it and get through this? It's still better if everybody's vaccinated because there's still significant protection there.
We've heard a lot, too, about hospitals and really being stretched and, as far as the severity of a person's health issues. First of all, how are you doing at Hackensack Meridian Health?
So we've seen a slow, steady rise in our hospitalizations, but it's a very interesting dynamic right now. The case rates in the tri-state area are going up like this. Mm-hmm. I mean, they're just skyrocketing. The hospitalizations are trickling up. And that's probably reflective of the fact this is a very contagious disease that moves very quickly, but is lesser severity than the other variants we've experienced previously. So the hospitalizations aren't tracking like they did in Delta. When the cases went up, the hospitalizations went up. So the big issue for us right now is less about people in the hospital than it is staff out of the hospital. We've seen our team members out of work, and I think all the hospitals across the tri-state are seeing this. So many of our team members are homesick. I mean, they're positive. They test positive for COVID. They most likely have Omicron. They're minimally symptomatic to asymptomatic, but they're out 10 days. And that's really going to put a strain on our ability to take care of not just COVID patients, but everything else.
Certainly. Do you think the elective surgery issue, do you think it's going to reach that point, or has it already, where some things are being postponed?
I think everybody's kind of doing what we call titration. There are certain, non-essential things that people are kind of juggling a little bit to try to make sure that they have staff available, that they can actually test all their team members, et cetera. Many states have already gone to no elective procedures. In New Jersey, everybody's still doing their electives to the degree they can. But if the rate of increase keeps going like it is right now, and the rate of team members out keeps rising, we're going to run into a situation where there's just not enough staff to do the work.
All right, Dr. Daniel Varga, we appreciate just helping us out here, and again, emphasizing the importance of the vaccine, the booster vaccine, and of course, the masks, and being careful around everybody. You too.
Absolutely.
You too, and we wish you, I know you are extra, especially healthy, wishing you and your family a good holiday, and your staff members as well there, Dr. Varga.
Thank you so much. Be well.
Thank you. Dr. Daniel Varga, the Chief Physician Executive at Hackensack Meridian Health.